Today I'll continue part 2 of this fluid, mentioning IV fluid given in heart failure or renal failure, and also blood products. So for intravenous fluid like normal saline and ringer slide is given to patients who have either heart failure or renal failure. Now this patient, they cannot handle excessive fluid, and that's why you must not rush it. Now these patients, if you look at them closely, they normally have edema, maybe peripheral edema on the legs because there is accumulation of fluid on the legs, because that is a symptom of what this condition called renal failure or cardiac failure. So imagine packing more fluid to this patient's heart or kidneys. There will be issues. And one thing that you likely see is that there might be fluid overload. And when fluid overload occurs, it impairs the heart function, whereby the hearts are beating fast. There'll be increased blood pressure. There'll be cardiac overload. There'll be increased blood pressure. There'll be the hearts, the lungs are also going to be destabilized, whereby to be struggling, difficulty in breathing. So these symptoms are things that you don't want to experience, and that's why you must not rush fluid in patients who have what renal failure or cardiac failure, which is what heart failure. Then the last one is blood products. Blood products can be maybe packed red blood cell, can be platelets, and the rest of them. Now you don't rush this fluid, you don't rush these products, because there is already a rate. As I said initially, there's already a rate prescribed for this blood transfusion. Now if you rush blood transfusion, you will likely experience that the person will have overload, which is fluid overload or cardiac overload, whereby there is a lot of fluid around the heart and it's causing pressure. And that's why patients who is going to take a blood transfusion, after everything, they'll give the person a diuretics like the Lexis, just to help to reduce that overload, trying to remove excessive fluid from the heart, away from the heart, so that it won't cause overload. And it can lead to what? Hemolytic reactions, like if you see the person will be febrile, they'll be having itches around them, they'll be itching their body, they'll be having chills, they'll be feverish, pains. These are things that will be experienced if you rush blood transfusion. Blood transfusion should not be rushed. So please and please, as much as possible, try your best to, as a patient that you're in a hospital, just like yesterday, this thing happened to, do not for anything rush blood or fluids given to you. There is a reason why it's set on that rate. Don't go and kill yourself. What they say is what is enough for the wise one. Peace.